Erectile dysfunction often starts right here. Taking care of your heart, vascular network, and managing emotional stress are the true baselines for treating ED. For most men, the immediate medical instinct is to ask for a prescription pill. But those famous oral medications have a strict biological requirement. They only work if the nerve function to the penis is still intact. Out of 10 men taking these pills, 3 gray figures represent total failure. Conditions like diabetes, cancer, or nerve damage prevent the medication from working. Falling into this 30% makes it easy to assume your sex life is over. This 3-tiered diagram outlines how urologists approach the problem, an escalation ladder. If one tier fails, step therapy protocols guide you to the next. Climbing this ladder requires weighing physical invasiveness against how reliably it produces an erection. Finding a lasting solution means understanding exactly where you belong on this ladder, based on your specific medical reality and your personal tolerance for discomfort. Level 1 starts with the systemic foundation of your health. Doctors will push you to optimize your sleep to 7 or 8 hours, improve your diet with plant-based foods, and seek counseling to manage life stressors and performance anxiety. The medical intervention at this first tier relies on oral PDE5 inhibitors, drugs like Viagra or Cialis. To get results, you take them as a pill about an hour or 2 before having sex. This Level 1 scorecard shows what you get in return. With intact nerve function, these systemic drugs successfully improve blood flow for about 70% of men, with minimal invasiveness. The catch is the strict timing requirement. Planning intimacy an hour in advance eliminates spontaneity. Because the drug travels through your whole body, it also impacts other vascular tissues, often causing side effects like facial flushing, headaches, or indigestion. When Level 1 drugs fail, men often look to the internet. The erection economy is flooded with over-the-counter herbal supplements, promising an easy fix. The FDA explicitly warns against these. They routinely fail to work, drain your wallet, and worst of all, many secretly contain unapproved, dangerously high doses of the exact PDE5 inhibitors you might be trying to avoid. Level 1 requires strict planning, but it works safely for the majority. If it fails you, the answer isn't an unregulated internet scam. The answer is moving up to verified Level 2 medical therapies. Level 2 shifts away from pills entirely. These are localized therapies engineered specifically for the non-responders who see zero benefit from systemic medication. The first option on this tier is the vacuum erection device. It uses a plastic tube that seals against the body and a hand pump to manually draw blood directly into the erectile tissue. Looking at this Level 2 scorecard, the pump achieves a 75% success rate. It creates an erection that lasts up to 30 minutes, held in place by an elastic ring slipped onto the base. The major trade-off here is mechanical friction. Assembling the pump and operating it requires a hard pause in the middle of intimacy. The alternative at this tier is intraurethral therapy. Instead of a pump, you insert a tiny medicated pellet of a drug called alprostadil directly into the urethra, where it dissolves to stimulate blood flow. This method successfully avoids needles. However, it typically has lower efficacy than other localized options, and the most common side effect is a noticeable burning sensation in the penis. These initial Level 2 options successfully replace the pill, but the mechanical hassle and sensory discomfort during intimacy drive many patients to seek a stronger, more reliable rescue method. That brings us to the most powerful tool in Level 2, intracavernosal injections, or ICI. This requires injecting medication through a very fine needle directly into the side of the penis. This Level 2 scorecard shows why urologists rely on it. ICI is an incredibly reliable rescue method. It hits an 85% success rate, creating firm erections even for men who completely fail oral pills. The psychological barrier is steep. To access this level of reliability, you must undergo clinical training with your urologist to overcome the very real fear and friction of injecting yourself at home. There is also a strict medical trade-off. Because ICI is so potent, it carries the highest risk of causing a prolonged erection, a condition known as priapism. Priapism is defined as a painful erection lasting longer than 4 hours. If left untreated, the trapped blood damages the deep tissues. The safety protocol is mandatory. If an erection reaches that 4-hour mark, you must go immediately to the emergency room to have the trapped blood drained. Failing to do so causes permanent tissue fibrosis and complete erectile dysfunction. ICI is the ultimate bridge for the 30% who get no help from Hills. You trade a needle prick and strict medical vigilance for near-guaranteed reliability. Level 3 is reserved for men refractory to injections or who want to stop planning intimacy. The solution here is a surgical penile implant. The procedure requires anesthesia to place the hardware entirely inside the body. Surgeons insert either a fluid-filled pump system hidden in the scrotum or simple semi-rigid bendable rods. The initial trade-off is intense. You must endure a painful post-op recovery. Patients deal with significant bruising, swelling, and surgical discomfort that lasts for several weeks. This Level 3 scorecard maps out the ultimate result. Implants provide a permanent, hidden solution with incredibly high satisfaction rates. Because you control the firmness, you can return to totally normal, spur-of-the-moment intimacy without watching the clock. Keep in mind what this structure cannot fix. An implant creates mechanical firmness, but it cannot restore lost physical sensation or the ability to climax if those nerves were previously damaged by cancer or disease. Level 3 asks you to exchange significant upfront surgical pain and financial cost for a permanent escape from the anxiety of localized treatments and strict timing. This matrix aligns your medical reality with the right treatment tier. Beginners start with Level 1 pills, accepting timing trade-offs. Non-responders step to Level 2 ICI injections for an 85% success rate, trading discomfort. For permanent spontaneous intimacy, Level 3 implants trade surgical recovery. Regardless of your medical history or the problem's severity, ED is a highly treatable condition. It does not mean the end of your love life. The right treatment is simply the rung on the ladder where the reliable outcome outweighs your personal friction. Take the time to evaluate those trade-offs and consult a urologist to take your first step.